Hi, live. Jonathan Stoiano here. I've got a few questions. Sorry, it's pillows in the way. A few questions during this festive season. So, B-Lite implants. I'm going to talk about breast asymmetry, and I'm also going to talk about a breast augmentation for an opinion that someone's contacted us today through the Facebook, so I'll talk about that as well. Yeah, B-Lite implants. These implants, I was very pleased to see that they exist. It's a implant that I discovered at a meeting recently. It's something we've been talking about for quite some time, having a lighter implant. A lot of patients mention that implants feel quite heavy, and so I think there is definitely a room in the market for a lighter implant. It's interestingly that I've had a few comments from colleagues about then I'm not keen to use them because they are new and they haven't been tried and they need long-term studies. And I've just written a blog post about that actually, which I haven't published yet, but will probably be publishing maybe this week or next week, because it's an interesting concept whether we should wait until we've got longer term studies or whether we should offer them to patients. I think that I mentioned it to patients. I don't particularly say anything particularly supportive of them. I just say the facts that they are lighter, and that is a good thing that the breast implants are lighter, but they are new and people are often wary about new things. Having said that, it's not like they're a prototype or they're anything experimental. They are CE approved. They're approved to be used in this country, so they do have approval, and they are silicone implants which have got a long track record, or at least silicone implants got a long track record, but this may not. But I think they fill a gap in the market. I mention them to patients. I don't particularly push them. I tell patients they're new. They are more expensive, which is obviously a factor, but I do think they have got some good things about them. They're not available with the polyurethane foam coating yet, although I understand that the company are looking at bringing out a polyurethane foam coated one. So it's interesting to me, the concept of whether we should be offering patients these or not, because I understand a lot of doctors don't offer them. It's a bit like polyurethane implants. A lot of doctors don't even mention them, the fact that polyurethane foam implants exist. I think we should tell patients that they exist, whether or not we think in our own minds they're good, because the fact that they exist, that other people are using them, means that they're out there. And so it's part of informed consent that we fully inform patients of all the options, whether or not we can provide those options. So that's my view on it. And I do try and tell people about everything that's out there, and I can put my opinion on it, but then at the end of the day, it's your body. You have to make your own decisions as to whether it's right for you. So that's where I am with B-Lite implants. I do think the concept is sound. Very excited to discover that they exist, but they are new and they are expensive, so it's something to weigh up. Weigh up, pardon the pun. I've had quite a lot of comments about the masks that I had a couple of weeks ago. They've taken them off me. I think I used them too much, so I don't have them anymore as an option available, which is very disappointing. But I'm gonna push on. I'm gonna keep going, and sorry, just showing what these buttons do. So sorry about that. The other issue we've had is about breast asymmetry. I saw a patient last week who had previously who had an asymmetry between her breasts. First thing I would say is everybody has got an asymmetry between their breasts. In fact, everybody's got an asymmetry between the two halves of their body. I don't know if you've ever seen those photos where they make you symmetrical. They take one half and flip it. It always looks a bit odd. It doesn't look like you. So everybody's asymmetrical, and that's whether it's your breasts, whether it's your hands, your ears, your eyes. We're asymmetrical. The question when I look at someone with an asymmetry who's having breast implants is whether I'm going to put different size breast implants in. In this case, I thought not, and she'd previously seen a surgeon who thought that they would put different size implants in. And the issue here is the fact that implants don't come at a sort of infinite sizes. They come in set sizes. So there's 250 cc's, 270, 300, 320, whatever. They come in set sizes. So what I usually say to patients is, if you can imagine that I put, say, a 250 cc implant in, and then I have an empty sizer that I can then fill. If I then fill that sizer and I've got 262 cc's and I've got a perfect match, then I've got to decide whether I put, was it 250? I said, let's just say it was, whether I put another 250 cc implant in or I put a 280 in. So I either put one in a bit smaller or a bit bigger. I've got to decide which way to go. So when people have got a bit of an asymmetry, I always, and everyone does, I always say they'll still have a bit of asymmetry. The aim is always to balance things up and make things better. And often you'll find that if you put the same size implants in, a mild asymmetry can be less obvious when you've got a mild asymmetry of volume between the breasts, because proportionally it's less when you've got your breasts are bigger. So if you've got one's breast that's 50 cc, one's 100 cc, then that's one's twice the size of the other. If you put 400 cc implants into both of them, then one's 450 cc and one's 500 cc. So it's a much less, it's a 10% difference. It's a smaller difference in volume as opposed to a 100% difference in volume. Makes sense? Anyway, so like most things in plastic surgery, there's no right or wrong. My view was to put the same size implants in, and they'd still, the bigger breast would have still been a bit bigger. If I'd put different size implants in, then it may be that the bigger breast might have become smaller then if I'd put a smaller implant in the bigger breast. But it's all a matter of judgment, and just goes back to choosing a surgeon and someone you're comfortable with and who's getting good results and what have you. The other thing is, when you do have an asymmetry, something that I often do, which you probably won't want to get involved in, although I know a lot of people do like to get involved in this sort of stuff, is I often use a different profile when I use different size implants in order to maintain the width of the implant. So if you're going to put two implants in of different sizes, if you want to put them in about the same width, because I always say that the width is really crucial. So if you want to put an implant of the same width in, but say a bigger volume, then it's going to have to be a higher profile. I'm not sure if that makes sense, but that's often my thinking. Not always, but often, and it can get quite tricky and technical. Also, I want to talk to Georgia, if you're out there. Is that how you say Georgia? Because it's not got an I in it. I noticed that Laura was replying to you with an I, but it's actually Georgia. Second opinion for breast implants. Interesting, because I think you've had breast augmentation 10 months ago and you feel that you've got an asymmetry, and the surgeon has said that they're fine. You also have an ache on the right nipple and the right side has dropped. The ache is something that can happen. It's 10 months, it's quite a long time. I hope that will settle. There's not a lot anyone could do surgically about that, but I would hope things like that do settle. And they usually do settle. So I would hope that will settle, as long as it is something related to the surgery and it's not something else. So if you do get persistent aches or pains, or particularly if it's associated with any lump or anything like that, then it would be an idea to get it checked out by your GP, that there's not something else going on there. But if it is related to the surgery and related to the implants, then I would hope that would settle over time. The asymmetry between the breasts, it's interesting, because it's one thing for the surgeon to say everything's fine, but if you don't feel everything's fine, then everything's not fine. So this sort of surgery and this sort of field is very much driven by the patient. So if the patient's not happy, then it's not a good result. If the patient's happy, it's a good result. It doesn't really matter what, to a degree, it doesn't matter what a surgeon's no good a surgeon looking and saying, haven't I done a great job, if the patient's very unhappy with it. And similarly, if the patient's very happy with the result, then it's a great result, regardless of what the surgeon thinks of it. My view is that if you're assessing someone with regards to the results of surgery, you really need before and after photos. So I know that Laura, I think, said about before and after photos are really crucial, and you really need photos without any clothes on, because photos with clothes you can do things. You can make it not as obvious. But I know you have sent photos with, like that. Different views are also helpful, but the bottom line is I think there is an asymmetry there. I think it'd be interesting to see if there's an asymmetry preoperatively and whether you had to say same size implants, going back to what I was saying earlier. The main question is not so much is there something wrong or what have you, it's like can something be done about it? And I think that's the main issue when you're not happy with the results of the surgery. And I think that really boils down to exactly what the problems are. I think if the ache's the problem, then I think I would advise against surgery because that could make things like that worse. If it's the sort of I think there is a bit of a size difference. If there's a size difference between them, it's possible that could be made better by putting a bigger implant into the smaller breast. I think one is a little bit smaller, but that could bring it the other way, given what I've just said a minute ago. The shape is a little bit more difficult. I know you feel that one's dropped and moved over to the side. It's a little bit more difficult to control. The position of the implants, I'm presuming they're silicone implants because I know they were put on by a company that only used silicone implants. So it's a bit more difficult to control where the implant goes. Once the pocket has been made, you have to be very careful with making the pocket, particularly with silicone implants, because they tend to move within the pocket. So if the pocket's made too big or too far to the side, the implant can move to the side. One option would be change to polyurethane implants, which don't move so much, or to close the pocket down to try and reposition the implant. Not particularly easy surgery, and I think I would question how much it bothers you, because if it doesn't bother you greatly, then I think there's a lot to be said for leaving things alone, letting things settle. So I think it's not unreasonable to wait a year, whatever, following surgery before considering a revision. So you're not quite there yet. I think it's always reasonable to wait as long as you can and question how much it does bother you, because if you were to have further surgery, there's always complications associated with further surgery. And also it's always difficult when you're looking for little tweaks and little improvements to guarantee a significant improvement, and yet the risks are still quite high. So is that helpful? I hope that's helpful. I don't know. I don't know who's there. It always says Facebook's building an audience for me. So if you do have any questions or have any come back, I think there's a stream there, so you can always chat with me or Laura on the stream in the messaging of Facebook. So please by all means get back in touch with us. But that's my view on that. So I think that's all we got this week. I don't know. Next week's going to be getting into Christmas. I'm very happy. I think I'm very happy to be around and to answer any questions. If you've got anything between then and now and then, get in touch through Facebook or the usual channels. And same time, if you like, 7 o'clock next week. And yeah, we'll look forward to seeing you all there. And have a nice festive week between then and now. And we're going to be full flow but this time next week, because it's going to be, I guess you'd officially call it Christmas week. See you then. And I'm going to sign out and check out and carry on with looking after the children, which is what I am doing as a good husband and what have you. I've been doing the dinner and goodness knows what's out there now. So yeah, checking out and see you next week. Bye.